This educational content is brought to you by Dr. Keshav Narain, a dedicated specialist in retinal and optic nerve care at South Bay Retina. You might be in your 20s or 30s, feeling healthy, active, and full of energy. But sometimes, you might notice your vision becoming blurry, or see floaters drifting across your sight. Occasionally, vision in one eye can become dim or even temporarily dark. These changes can be surprising, but they're important signals from your body. For some people, these are the first signs of a rare condition called Eales disease. It's not very well known, and sometimes it can be mistaken for other things. That's why learning about it is so important. Early awareness helps protect your vision. Let's explore what Eales disease is, how it affects the eyes, and how new advances at South Bay Retina are helping people see better and stay informed. Most people, and even some doctors, might dismiss floaters or blurry vision as just stress or eye strain. But in Eales disease, these warning signs are just the beginning. Eales disease is a rare inflammation of the retinal blood vessels. It can cause bleeding inside the eye, blocked circulation, and the growth of fragile, abnormal blood vessels. And here's the kicker. It often affects both eyes, usually in otherwise healthy young adults. Without proper care, it can lead to retinal detachment and permanent vision loss. Traditional treatments often focus only on symptoms, not the cause. That's where South Bay Retina does things differently. At South Bay Retina, Dr. Keshav Narain uses a layered, evidence-based approach to detect and treat Eales disease early, before major vision loss occurs. First, diagnosis. It starts with specialized eye imaging, including fluorescein angiography, OCT, and dilated retinal exams, to identify subtle signs of bleeding and inflammation. Next, testing for underlying causes. Eales disease is often linked to immune responses, especially in people exposed to tuberculosis, even if they don't have active TB. So Dr. Narain includes TB screening and a full systemic workup. Because treating only the eyes isn't enough, we have to treat the whole person. Then comes targeted therapy. This includes steroids to calm inflammation, anti-TB meds if needed, anti-VEGF injections to stop abnormal vessels, laser treatments that fix damaged areas with minimal harm, and if bleeding won't stop, a delicate vitrectomy surgery. But here's what sets South Bay Retina apart. We also monitor for drug toxicity using advanced visual evoked potentials, especially for patients on medications like ethambutol, which can harm the optic nerve. The result? Patients often regain vision that might have otherwise been lost forever. With early care, we don't just stop the bleeding, we stop the disease in its tracks. South Bay Retina's tailored approach means faster diagnosis, more effective treatments, fewer complications, and long-term vision protection. One patient said, "I went from barely seeing to driving again in just a few months." Eales disease might be rare, but it teaches us a bigger lesson. When it comes to vision, symptoms should never be ignored. Early testing saves sight, and with diseases that are connected to immune dysfunction and infection, like tuberculosis, this isn't just about eyes, it's about whole body health. This is why advanced eye care, like what we offer at South Bay Retina, matters more than ever. Eales disease doesn't have to mean losing your vision. With the right diagnosis, the right tools, and the right team, there's real hope. If you, or someone you love, experiences floaters, blurry vision, or sudden vision loss, don't wait. Schedule an evaluation with Dr. Keshav Narain at South Bay Retina today, because when it comes to your sight, early care changes everything.